If you want to be a surgeon, you have to practice suturing. So let's get started. Today we're going to do the most simple and basic kind of stitch, the simple interrupted stitch.
So that instrument he's grabbing it with is actually called a needle holder. Obviously, usually this is done with gloves, and that little tweezer on the right side there that you can barely see is called a forceps. That one looks like a specific one called a single tooth forceps.
We load our needle 2/3 along the curve of the needle, perfectly perpendicular to the driver.
So the forceps, as you can see, he's holding like a pen. And then the needle holder, he's holding in the palm of his hands with the thumb and the forefinger extended out.
We're going to enter our tissues perpendicular to the skin and rotate. Because we're learning, we're going to take it in two.
What he means by that is expert doctors like myself would pass that needle all the way across and come out instead of doing it in two shots.
We're going to reload the needle driver, enter deep and rotate. And finally, we're going to do our instrument try. 2 overhand throws.
So the 2 overhand throws is actually called a surgeon's knot. And what he's doing is a square knot as well, because he's changing the direction by flipping his hands back and forth. So that last one, he didn't really square. He should have crossed his hands over. But squared knots are tighter, have less bulk to them, and are stronger.